with you. And in case you're wondering, Cito, are you planning to become a priest? Well, not really. I'm not. Neither am I planning to be a pastor. But nobody knows what the good Lord wants. In any case, I am greeting you. Peace be with you, because I picked it up on the daily devotional of Victory Christian Fellowship, and it struck me. If there is anything that many of us want nowadays, it's peace. Peace of mind, peace at home, peace in the community. And it is not because we are at war, but because many of us are very troubled. So I begin the day greeting peace be with you. It's a Wednesday, March 31, 2021, and sana naman po magkatotoo yung sinabi ko sa column ko, what I wrote in my column. I just hope that the Ides of March, which was at March 15, and all the so-called bad luck that came with it, would now pass after today, because we have had record cases of COVID-19, and hospitals are full, and there are issues cropping up regarding contact tracing, regarding subsidies or ayudas, etc., etc. And then we also have viewers who have questions of their own, and we will try to address many of that. This morning, in case you might notice some disruption, I'll call it disruption, technical disruption, it is because I have decided to operate on generator power, because Batelec, which is the Batangas Electric Cooperative here in Lipa City and Batangas, has informed us na ginawa na naman pong preno, okay? Ginawang pampara ng truck yung poste nila. You know, it just occurred to me, I think we need to send all of these drivers to re-education camp, yung mga truck drivers, na former tricycle driver, na naging jeepney driver, na naging pahinante sa truck, na naging truck driver. Because apparently it's become a cultural, phenomenon. If you lose your brake, look for the nearest wooden post or tree and slam it there to stop it. I mean, fix your stupid truck, please, okay? And we were informed by Batelec that we will have power disruption kasi papalitan nila yung poste. Now, my hats off to the Batelec people, because, maybe like 25 years ago, you have to thank Batelec to give you electricity. But nowadays, they actually have a Facebook account. Their power is consistent, and they're on the job, especially during typhoons, etc. So congratulations, and credit where credit is due to Batangas Electric Cooperative. Okay, I'm Cito Beltran, your host, welcoming you to the program agenda, and you are watching us via Signal TV, channels 8 and 250, as well as on Facebook.com/OneNewsPH, and you can also watch us via YouTube and Signal Play by getting the Signal Play app. Today, we will be interviewing two very important officials. First would be Undersecretary Jonathan Malaya of the DILG, so that he can clarify certain points regarding the subsidy, regarding the dilemma of mayors tungkol sa mga subsidy na yan. Kasi marami pong mayor, barangay captain na nagkakamot na ng ulo. Yung isa nga sabi sa Cito, ayan na naman yan. Kami na naman yung hinahanapan ng pera, kami yung hinahanapan ng pagkain, kami yung pinipilahan sa harap ng bahay namin. Kasi nauuna na naman yung dada kesa sa gawa. Yeah, well, the reality is, the government said first, I think I can say this with authority, it was first said there would be no ayuda because the quarantine or the community quarantine would be, ECQ would only be for about a week, Holy Week lang. Then suddenly, hindi, magkakaroon ng ayuda. Yung ayuda magiging kind. Yung ayuda, pwede na rin maging cash. So yung mga mayor and barangay captains are all scratching their head and saying, ano ba talaga? Okay. Now, after Jonathan Malaya, we will also bring in Undersecretary Maria Vergeire and to clarify yung mga pumuputok na issue kasi gusto raw habaan itong ECQ. Meron naman mga nagsasabi yung ivermectin, may mga nagsasabi na yung mga ospital puno na, alamin na lang natin para walang fake news, straight news. Okay. And speaking of straight news, we will, wait a minute, let me greet some of our viewers. Mr. Danny Ildefonso, magpagaling ka bro, kasama ng pamilya mo. We also want to greet Roy Regoso, magpalakas kayo, patuloy kayo. Wala naman diferensya si Roy, malakas lang kumain yung kaibigan kong si Roy. And greetings to our barangay captain here in Barangay Inusluman, Mike Olgado, and Councilor Boggs, kasi tinulungan po nila ako magkaroon ng certain documents without me having to go because syempre mahirap na baka madali tayo ang magpo-programa dito yung aking bawaw. Anyway, if you have just to cheer you up. By the way, tomorrow, Thursday and Friday, agenda won't be airing. We are going to we quiet down, no program in observance of the Holy Week. Pinapaabot na namin po sa inyo kasi baka bukas magbukas kayo ng TV at sabihin ninyo, nasaan na si Cito? Na-COVID ba? Wag naman po, okay? Baka naghahanap lang nung gansa na nawawala. I bought a pair of geese last night and they're gone. They've decided to fly south. Okay, let's go to the headlines of the Philippine Star. The Department of Health recommends to extend the Enhanced Community Quarantine or ECQ in NCR Plus for 1 more week. Okay, isang linggo pa po. In a few moments, let's talk about that matter with Health Undersecretary Dr. Maria Rosario Vergeire. Okay, now next up we have cabinet officials clarified President Rodrigo Duterte's command to allow private sector to import vaccines at will by all you can. Palace spokesman Harry Roque and Vaccine Czar Carlito Galvez said that the tripartite agreement with government is for emergency use, not for commercial use. The tripartite agreement will also cover the indemnity provision under the law. Okay. And then in the other news, 2 local pharmaceutical firms have expressed interest to register and produce ivermectin, says the ARTA or the Anti-Red Tape Authority. Kasi yan pong sa ivermectin, nag-expire na yung kanilang license ba kumbaga, and kailangang ma-rehistro ulit for production in the Philippines. Kasi may, kumbaga, parang TV ba? Parang radyo, may franchise, may prangkisa, parang bus, may prangkisa. Yung gamot, meron ding parang kahalintulad, similar, it has an equivalent where the FDA gives approval for the production of the medicine. So 2 companies have apparently applied for the production of ivermectin in the Philippines. The question is, registering it, will that allow them off-label use? Kasi yung ivermectin po ay pampurga, pang-alis ng bulate. Ginagamit na ngayon, and ito po, there is no stopping people if they really believe it's helping them, that ivermectin use. So now, what's happened? There is now some form of pressure or parang bulkan ba? It is building up and people are now really pushing for ivermectin to be approved. I'll talk to Usec Vergeire about that later in the program. Okay, before I go to our first guest, let me just check my notes here. Okay, I think I've done... okay, here's another one. The latest Philippine Statistics Authority report shows that 4.2 million Filipinos remain jobless. Yan po, no? Marami po tayong mga kababayan na walang trabaho ngayon. Now, Holy Week naman po, no? And please forgive me if you are Catholic and you feel that I am being sacrilegious or a heathen and a bloody barbarian, sabi nga nung mga tiga-Holland noon, ano. But if you could find it in your heart, wag na po kayong mag-fast and abstinence. Ang gawin nyo na lang, ang gawin ninyong sacrifice para kay Lord, bigyan nyo ng trabaho kahit pa-extra lang yung mga nandiyan dyan sa barangay ninyo na walang trabaho. Give jobs. Stop counting the money. Because, you know, by the way, my friend Claire de la Fuente passed yesterday. Namatay po yung batikang singer. And alam nyo, hindi kami barkada ni Miss Claire. Pero at one point, she showed me kindness that was unexpected. May sitwasyon, siyang nag-intervene para hindi ako madamay dun sa kahihiyan na nangyayari. Ako yung nilayo niya, sabi niya, Cito, umalis ka na dyan. Dito ka na, baka madamay ka pa dyan sa kalokohan na yan. So, umalis na kami, no? And she's always been nice to me. Yes, Gab, I know Undersecretary Malaya is there. Please allow me to do my work first. I am asking our viewers, please do the kindness of giving jobs to people this Holy Week. Yun na po ang magagawa ninyong magandang sacrifice. Okay? Puntahan na po natin ang ating first interview, Undersecretary Jonathan Malaya of the Department of Interior and Local Government. Good morning, Usec John.
Yes, good morning, Sir Cito. Baka yung mga gansa mo have gone to hibernate?
Sabi sa'yo, nagpapagawa na nga akong tirador eh. Pag inabutan ko, titiradorin ko na lang eh. Kakainis eh. Mahal-mahal pa naman. Sabi ko nga bili tayong gansa para sa mga pangkontra sa magnanakaw. Kalabas-labasan eh. Hindi na pala sila kailangan nakawin. Sila pala yung tatakas. Walang yan po yan. In any case, nice to see that you're doing well. You're continuing to be healthy and matanong ko, umpisahan ko na yung tanungan natin, Usec John, I am sincerely concerned. I have always been concerned about our police officers and I have always pointed out na dapat matraining at mabigyan ng tulong yung mga kapulisan natin kasi yung contact nila dyan sa mga checkpoint na yan at sa mga inspection areas, talagang sabi ko, they are really exposed. And now, apparently, there was this mini scandal of sorts, naging drama sa PNP. Kasi maraming nag-overflow raw yung kanilang facility doon, yung holding facility for COVID-positive officers. What is the situation with our policemen, policewomen, as far as COVID infections go, as far as hospital facilities go, and for prevention of COVID?
Well, hindi ko lang dala, Sir Cito, yung datos. No? I did not know that this question would be asked this morning. No, but relative to the number of cases, it's just the same. No, what we have sa ating bansa na tumataas sa NCR, ganun din ang sitwasyon sa ating kapulisan. And it stands to reason. It stands to reason because as you said, sila talaga yung pinaka-exposed. Yung nangyari sa Krame was talagang napuno lang sila, but that only happened for one night. No, nagsabay-sabay kasi na yung isolation facility nila ay napuno na. But immediately the next day, they were brought to much better facilities outside of Krame. So na-solusyon na po yun. Now, what we need to do is to ensure, kasi di naman natin pwedeng pigilan yung ating mga kapulisan magtrabaho. No? Kung hindi sila magpapatupad ng mga quarantine protocols natin, no one will do it. No? So, ang importante talaga ay mabakunahan na sila. No? That is why we continue to appeal to the DOH and to the NITAG na i-prioritize naman yung ating kapulisan because they are not in the A1 to 3. In fact, Ngayon, meron ng mga nagbabakuna na senior citizens, meron ng comorbidities. It's now full blast, and we just received the Sinovac deliveries yesterday na 1 million. So we now have enough for many of our police officers. Yung ibang mga police, sa ibang LGUs, pinabakunahan na sila ng kanilang mayor. You know, the mayors took it upon themselves na, kailangan kong alagaan itong mga kapulisan na ito. So, pinabakunahan na. But the vast majority hindi pa po. That's why we continue to appeal to the DOH to prioritize also the vaccination of our police officers.
Okay, kasi nagtataka nga ako doon, Usec, no? And I'm not trying to start another controversy or a debate here, but it was the FDA and the DOH who said that the Sinovac vaccines are not intended or should not be used for senior citizens because no testing were done for senior citizens. Now, bakit hindi ibigay din sa kapulisan? So ano po ba ang sinabi na nung National Task Force?
Well, we're still waiting for word from the Department of Health kung maisasama na nga yung ating kapulisan, because you're correct, Sinovac lang naman talaga, no? Kasi yung AstraZeneca parang reserve na natin yun for our medical frontliners. And pag naubos na yung medical frontliners natin, then we can use the AstraZeneca for the senior citizens.
Okay, so now so ayos pa rin yung mga kapulisan natin by and large. Hindi pa pumuputok sa bigger population of our police force. Kasi, di ba, ilan lang ba police natin? 150,000 ba?
That's correct. Yeah, around that number.
150,000 eh. Ang balita ko, 1,600 na yata yung tinamaan ng COVID or something like that. Medyo ninenervyos ako. Sabi ko, sila yung nasa frontline. And then, yung isa pa pala, yung napansin ko yun, Usec, no? They would check IDs with their hands, with bare hands. And sabi ko, ay nako, yan yung mga problema na kami nga, pag sa mall, pag inabot sa amin yung parking ticket, ilalagay namin sa isang box, ni-spray ng alcohol kasi hindi mo alam kung sino yung humawak doon, pati yung doon sa mga pindutan.
Yeah, nakita ko rin yan sa isang report, in a news report na may mga pulis nga tayong walang gloves. Yung iba ang ginagawa, hindi nila hinahawakan yung ID, pinapakita nilang binaganito sa kanila. Pero yung iba wala, no? So last year during the ACQ, we still had police officers using gloves. Hindi ko lang alam ngayon kung bakit. But we will bring this to the attention of the Philippine National Police leadership para magawa naman natin ang paraan. Yung proteksyonan yung ating kapulisan.
Yeah, speaking of frontliners, what's the situation with mayors and governors? Nung isang araw, may lumapit sa akin din sa Lipa and sabi sa akin, Sir, nabalitaan mo ba yung batang-batang mayor doon sa Laguna? Na matay daw ng COVID. So kahapon, tinanong na naman sa akin ng isang local official dito kung confirm ba yun, kung fake news. What is is that true that a mayor in Laguna died of COVID, and what is the situation for local government officials nationwide?
I personally have not heard na merong namatay sa COVID yesterday na mayor ng Laguna. But our mayors are just like our normal human beings, no. Madami sa kanila ang nagkaka-COVID din, no. Dito sa Metro Manila, ilan-ilan na rin sila. The last is of course Mayor Joy Belmonte. Si Mayor Zamora gumaling na, no? So talagang nasa frontline kasi sila, hindi mo talaga mapipigilan. They cannot stay at home all the time. They have to go out. So they know naman that they have to protect themselves because pag hindi nila pinodoktehan yung sarili nila, how can they run the city properly? So they are last night we just had a meeting with them. Talking about the ayuda, talking about COVID response, no. Karamihan naman sa kanila are in good health and are protecting themselves and their families.
Yeah. Now, you mentioned the ayuda or the subsidy or assistance to those affected by the ECQ lockdown. Maski na dito sa Batangas, dito sa Lipa, mukhang nag-declare na rin ng ECQ kasi para na lang kami extension office ng Metro Manila. Sobrang lapit na namin sa Metro Manila. Matataas na rin yung kaso dito. Now, what was the sentiments of the mayors and did you have barangay captains with you? Kasi may mga nakahuntahan ako kahapon sabi sa akin, sir, ayan na naman, kami na naman ang pagbibintangan dyan. Kasi biniro ko sabi ko, mamumula na naman daw yung mga hasang ninyong mga local official dahil may pamimigay na naman kayo, ilalagay niyo yung pangalan nyo. And you know, one of them told me, sir, alam mo, sa totoo lang, bibigyan kami ng order ng DILG, iuutos namin sa mga konsehal namin, sa mga tanod, etc. Mamimigay sila. Merong hindi mabibigyan kasi may guidelines ang DILG at saka ang DSWD. Pag hindi nabigyan yung mga yon, kami biglang magnanakaw overnight. Is there some way where we can do this na hindi napapagbintangan ang mga barangay captain, ang mga mayor na sila ay si Kapitan Kawatan?
Okay, so Sir Cito, ganito, no? I think yung naging problema natin last year when we did the SAP distribution was mixed messaging also, because hindi natin naipaliwanag ng maayos, no, yung pamimigay ng social amelioration program. There was some confusion at the beginning kung ito ba ay individual o per family. Okay? So that's the difference now dito naman sa ating panibagong pamimigay ng pondo is that we can start from a clean slate. Actually, we have a meeting this morning with DSWD Secretary Rolly Bautista para ayusin yung guidelines natin. But itong guidelines natin, Sir Cito, no, without napangunahan si Secretary Rolly who will make the formal announcement. Itong ating guidelines this year will be more flexible to give the LGUs more discretion on the distribution. Kasi laging pinag-aawayan dyan yung qualification. Okay? Last year kasi may 4Ps na nakahiwalay, and then meron din nakahiwalay for the transport groups, no? So pag wala sa listahan ni SAP, nagrereklamo bakit wala kami diyan. And then yung mga taga 4Ps, yun pala nakapapalista rin uli dun sa SAP, no? There was that kind of approach, no? This year for this ECQ wala tayong ganon. The money will be directly released to the local government unit. Dati kasi dumadaan pa si DSWD. Okay? And then from the DSWD, tinatanggal na niya yung 4Ps, dinidiretso na niya sa 4Ps accounts, and then the rest will go to the local government unit based on a menu. Okay? Ngayon po, based on what the President approved, which is 1,000 per individual, in the NCR plus area, not to exceed 4,000 per family. Okay? So, yung initial discussions namin with the mayor is that we will as soon as magawa yung announcement ni Secretary Rolly Bautista kung sino yung mga beneficiaries, the LGUs now have discretion on the process of distributing it. So, for example, if the mayor...
we'll go for a 1-minute break, sir. Alam mo naman, kabuhayan to, pero I will give you the platform immediately after we return from the break. We'll be right back. Okay, you're back here on Agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV, channels 8 and 250, brought to you by PLDT Home Unli Fiber Internet. Okay, pasensya ka na, Mr. Mark Borlogan. Hindi mo naman talaga ako advertiser. Nagpapanggap lang ako. But because we appreciate the consistent service and excellence of PLDT Fiber here in Lipa and even in Pasig. Okay, let's bring back Undersecretary Jonathan Malaya. Usec John, you were saying.
Yes, so I was saying we will give to the local government units the discretion on how they will distribute the funds to their respective constituents in the most expeditious manner. So kung maliit lang naman ang LGU natin, pwedeng si treasurer na ang mag-distribute ng pondo using the pagador or the treasurers, yung mga tellers. And then kung house to house na lang yung pamimigay, then that's their discretion already. Ang requirement lang sa tingin ko, without preempting the joint memorandum circular, is that there must be an appeals committee in every LGU. Para kung sakasakali may reklamo na naman, Sir Cito, na ay wala ako sa listahan, ganito, merong tatanggap ng mga reklamo. And then the DILG and the DSWD plus the Philippine National Police, we should have a inspection and monitoring committee per LGU, which will serve as the court of last resort. Para yung reklamo ng ating mga kababayan, hindi na natin ipapadala pa sa central office. It should be resolved on the level of the local government unit.
Okay, klaro na merong parang appeals board or committee de argumento. Pero meron lang ako kasi ewan ko ba, parang binubulungan ako ng anghel eh. Sabi, Cito, tanong mo, walang tao dito. Walang tao dito sa booth ko. Pero I'm just sensing it. Kasi alam mo, napabayaan last year daw yung mga single parent na nahiwalay, iniwanan, etc. Tapos, binilang isang tao lang. Yung mga minor, hindi kasali yata sa bilangan. Dito ba sa utos ni Presidente, ano ba ito, ulo-ulo? O is it based on age or mouths to feed? Paano ba yung kakalabasan nito, Usec John?
Yes. Dito po sa kautusan ni Presidente, it's 1,000 financial assistance for individual beneficiaries. So long as hindi lalampas sa 4,000 per family. So individual po ang pinag-uusapan natin dito. So Sir Cito, it's possible that in one household there are 3 families.
Yeah. Oh.
Okay? So ang mangyayari diyan, bibilangin sila merong individual basis din. Kasi if it's 3 families, sabihin natin yung lolo at lolo nakatira doon. So they can be one family. So they will receive 1,000 each, which is 2,000. And then yung anak, di ba? Sabihin natin yung anak niya, tapos may 2 apo doon. So 3 lang sila. So since 3 lang sila, up to 3,000 lang. Hindi po pwedeng umabot sa 4,000. Okay. And then, kung merong hipag na nakatira doon na 2 lang, edi hanggang 2,000 lang sila. Ang bilang po natin dito ay per individual.
Okay, hindi yung porque pare-pareho ang apelyido, iisa lang ang bilang. At
correct, yes.
Yun. So ulo-ulo per head of the family plus his or her family not exceeding 4,000. Para that's maliwanag. Right. Okay, yun po. Ngayon may appeal lang Usec John, napakiusapan ako at ipapaabot ko sa iyo kasi alam ko napapaabot mo naman sa IATF. Kung maaari lang daw po, maganda naman yung ginagawang solusyon ng pamahalaan. The government is doing the right thing and making the right announcements and is very responsive. The problem is oftentimes our spokespeople or our officials speak too soon. Kasi katulad nitong sa ayuda, sinabi ni spokesman Harry nung una, walang ayuda, pagkatas biglang may ayuda, pagkatas ngayon mayroon ng ayuda in kind. Ang problema sa mga bara-barangay, sila raw ang hinahanapan na ngayon ng tao, kinakatok na sa mga bahay-bahay. Sabi nila, baka naman pwede bago mag-anunsyo, i-position na, mag-pre-positioning. Kasi ginagawa na rin ng DSWD po ito, na pag may alam silang padating na bagyo, naka-pre-position na yung kanilang mga relief goods. Baka pwede raw yung paabot to because I don't know about you, Usec John, ano? I am not convinced that we are nearing the end even with the vaccines coming to the Philippines. What do you think?
That's a very good point na paghandaan na. That's why, alam nyo naman ko sa Sir Cito, pag pinag-uusapan ang pera, nagkakagulo ka agad ng Pilipinas, you know?
Totoo.
Ay, nako. Oo. So kahit wala pang announcement, tungkol sa distribution, pinupuntahan na kaagad yung mga barangay.
Oo.
Unang-una po, ang naaprubahan pa lang ng Pangulo is the availability of the money. So, definitely, there's 22.9 million. Buti na lang meron tayong naiwan na pera mula sa Bayanihan Act na hindi pa nagagamit. So, na-realign natin ito. There is no need for legislation for this, no? So, we have 22.9 billion pesos available for distribution, as I mentioned kanina, 1,000 per individual, no? So, wala pa po tayong formal announcement as to the beneficiaries. Kasi may magsasabi na naman dyan, bakit di kami kasama? Sandali, di nyo pa masasabi hindi kayo kasama dahil wala pa namang announcement as to the beneficiaries. Linuluto pa lang po namin. But ito lang siguro ang masasabi ko, Sir Cito, please wait for the announcement of Secretary Bautista on the beneficiaries of this aid. And number two, sisiguruhin po ng DILG na magkakaroon ng appeals committee sa level ng LGU para hindi na po kayo pupunta sa DSWD para magreklamo. Ngayon, kung sakaling hindi po ma-actionan yung inyong reklamo sa level ng LGU o sa level ng mayor at you really insist that you are qualified or you're kung ano man, kung merong katiwalian. Okay, isa pa yan, Sir Cito, kasi it was proven na may katiwalian nga in the last distribution by some, not all, by some LGUs. Meron po tayo oversight committee per LGU din para decentralize din ang ating action sa lahat ng reklamo.
Okay. Yung naman sa contact tracing, Usec John, kasi mukhang kumulo na dugo ni Mayor Benji Magalong nung inanalyze daw itong nangyayaring contact tracing. Apparently, there are many LGUs who insist on using their own version. There are many LGUs who stopped hiring contact tracers, have taken out the fund for contact tracing, etc. And now it is one of our kumbaga pilay. Doon tayo na pilayan dyan sa contact tracing.
Well, contact tracing kasi, Sir Cito, are two parts. Number one is the individuals, the number of contact tracers that we have, and the performance of these contact tracers. The other aspect is, of course, digital contact tracing. So, doon sa manual contact tracing, which is the calls and the pupuntahan sa mga bahay or what, meron na po tayong around 240 to 250,000 contact tracers nationwide. And dito sa Metro Manila, we're deploying more. No? Actually, yung ibang contact tracers natin sa mga probinsya na hindi natin mai-deploy dito, because of the COVID situation. Ang ginawa natin, they do the contact tracing virtually. So there are some 6 or 7 LGUs in Metro Manila who are receiving help from contact tracers who are in the provinces, who are in the regions. Okay, kasi mababa naman ang kaso sa regions, they do their contact tracing virtually. And we have deployed additional PNP and additional BFP personnel na physically reporting to the local government unit. Of course, we respect Mayor Magalong. He's our contact tracing czar, no? So nung tiningnan kasi namin yung report niya sa Kongreso kahapon, may sinasabi siya na ilang regions na hindi nakakaabot dun sa ratio. I think it's a problem of data. Iba yung datang nakarating kay Mayor Magalong. So we will provide him with the latest data coming from the regions para makita niya yung actual situation. Now,
Mhm.
with regards to the digital contact tracing, kakalipat lang po niyan, Sir Cito, sa amin yung Stay Safe application.
Yeah.
Kakalipat lang sa amin ng notices last Monday. Okay?
Mhm.
So, our next step now is to have the local contact tracing apps integrated. And that was one of the topics discussed last night with the mayors of Metro Manila, na yung kanilang tech people should now talk to the DILG's tech people para makapag-shake hands na yung dalawang sistema. Now, that means na yung mga taga-Mandaluyong who are using the Manda Trace can continue to use the Manda Trace in Mandaluyong, but yung kanilang datos will now go to the Stay Safe database para magamit ng buong bansa in our contact tracing efforts. So we hope to complete this by next week, na lahat ng mga local contact tracing apps should now be integrated with the Stay Safe application.
Okay, that basic consolidates data collection. But on the other hand, from the consumer or citizen side, our problem is when we go to well, ngayon outside of Metro, the NCR bubble naman, ano, yung mga pumupunta sa iba-ibang probinsya o iba-ibang bayan or city, every city has its own ID, and if you don't have the ID, you have to fill up a form, etc. What about a consolidated single contact tracing ID that is downloadable? Kasi yung sa Pasig, ang nangyari sa akin nun, dinownload ko lang sa internet, nilagyan ko ID picture, pinalaminate ko, bingo, functional yung contact tracing app ng Pasig. Pero pagpunta ko sa Mandaluyong, sir, hindi pwede. Ngayon, okay na yung Mandaluyong Pasig, meron na silang parang cooperation. What about the suggestion or demand of the public for one ID only?
That is what Stay Safe provides, Sir Cito. No? The Stay Safe application, you have your own QR code. So yung QR code na yun, that's what you need. Diba? That's what the different LGUs are requiring. So pag dinownload mo na yung app and you have registered there, you now have your own QR code, and people can do what you do. You can print the QR code and then laminate it and then use it.
Okay.
So yan sana yung gusto natin mangyari in the beginning, but because hindi na turn over kaagad-agad sa DILG yung Stay Safe application, yung mga LGUs nagkanya-kanya ng mga local apps, but the integration is possible, and we have started integrating since the system was turned over to us early this week.
How soon will it take for all of that integration to happen, for us to get our Stay Safe IDs and our QR codes and the system running? 1 month?
Immediately, Sir Cito, the individual there are now 15 million users of Stay Safe. So pwede na po kayong mag-download ngayon, right? At this very instant, you can already start using. Some 600 LGUs are already using Stay Safe as their official contact tracing app. Ang problema lang talaga natin, yung ibang LGUs na nagsarili. So that is the long process of calling them, integrating their system with us. Bukas pa naman is Holy Thursday. So I think ma-roll out natin na maayos to by next week, once we get to talk to the different tech people of the different local government units who have their own contact tracing app.
Okay, well, thank you very much, Undersecretary Jonathan Malaya. As always, a lot of information, a lot of clarification, and thank you for your time and your patience. God bless you, sir.
Thank you, Sir Cito, at mabuhay.
Okay, that's Undersecretary Jonathan Malaya of the Department of Interior and Local Government. From there, let us now move on to our next equally important guest and interview. We have Undersecretary Maria Rosario Vergeire of the Department of Health, Usec. Good morning, ma'am.
Magandang umaga po, sir.
Looking good. That's mukhang color mo yan eh. Okay. Usec, first, I guess, clarifications, please. You are one of the key persons being featured in media saying that 1 week is not enough to bring down the cases, that we need to extend the ECQ in NCR+. Your response and your explanation, please.
Yes, sir. Actually, I'm talking about the health perspective when I
Yeah.
say that 1 week is not really enough. Pag tinignan po natin, nung nagkaroon tayo ng surge ng July and August, yun pong ating mga kaso ay bumaba after 10 days pa. Yun pong ating healthcare utilization, nag-peak pa siya after ng mga 1 to 2 weeks after having that lockdown. At saka siya unti-unting nagkaroon ng breathing space after maybe 4 weeks to 5 weeks. So pag tinignan ho natin yan, talagang wala ho tayong makikitang improvements in this next week. Wala pa ho. Yung numero po na tinatala natin ngayong linggong ito ay galing pa sa mga numero 2 weeks prior or maybe a week prior. So hindi pa ho natin makikita yung effect. Now ito pong 2 weeks na ideal for the health system would be for us also to manage our health system capacity. Nakikita ho natin nagcho-choke na yung mga ospital natin. And this 1 week might not give them that yun pong bakante or ma-manage po natin ang sitwasyon. That's why from the health perspective, 2 weeks will be ideal for us. But now economic managers and health managers are discussing about analysis of the situation, whether we can extend or not.
Okay, I know that you are a government official, that we need to be circumspect about what we declare, etc. But I think there are many people out here who totally agree with you and would actually say, pa 1 week pa tayo, sagarin na natin, one time, big time na lang. From the medical perspective, if 1 week is not enough, will 2 weeks be enough? Because we've never had cases this bad, and we've never had variant viruses that we are now grappling and wrestling with. Is 2 weeks going to solve the problem, or in all honesty, should it be longer?
Well, in all honesty, there was this forecast done by our experts from Faster, and they said if we are not going to impose this hard lockdown or the stricter quarantine measures until April 18, our cases, active cases, will reach until 430,000 by the end of April. And this is their forecast. So their recommendation was for us to continue on with another 2 weeks. But in the IATF, we also agreed to this, that what we are going to do would be a week-to-week assessment. We cannot say now, right now, that we are going to extend next week. We need some form of assessment before we can say that, because it is not just health that we are talking about here. We are talking also about the economic lives of people. That's why health sector also understand that point. Kaya nga po tayo ay pumayag na, sige, every week tayo mag-assess, tignan natin kung kailangan pang i-extend after 1 week of doing this hard lockdown.
Pasensya ka na, Usec Vergeire, no? Kasi may pagka-diktador din ako, and I'm also desperate because I lost a friend last week, a very good friend. I lost another friend this week, and my pastor is in the ICU. So I think I'm representative of many Filipinos na kung para bang sobrang frustrated na birahin na natin to, mag one time, big time. But going back to that group you mentioned in the DOH, yung Faster, because I realized just this week, yung Octa Research Group, when they started doing their work early on, maraming nagalit sa kanila. There were people who were saying, masyado kayong crystal ball, masyado kayong presumido. But now we're discovering that the mathematicians, based on the DOH data, were on the ball and were predicting the right outcomes. Now, yung Faster Group po ninyo, ngayon ko lang nadinig honestly, who are they and what is their track record?
Yes, sir. We had been with them since the start of the pandemic. Actually, in the IATF, there is this data analytics team na sila, ito pong data analytics team, kami po yung nagtatrabaho para malaman natin kung ano yung ating magiging ECQ or quarantine classification every month. And they are the ones computing or estimating or analyzing for us. They are from Ateneo and they are from various fields in science. So sila rin po ay credible institutions. Ngayon po, kailangan din maintindihan ng ating mga kababayan. Kasi kapag gumagawa po tayo ng mga forecast, ng mga estimations, these are based on assumptions. So kailangan yung assumptions natin valid para yung forecast natin mas acceptable. And this is something that we consider when there are this kind of forecast. Kaya nga ang lagi nating sinasabi, we are all open to this forecast done by Okta. Ngayon meron naman kaming faster na ginagamit. It guides us into this decision making that we are doing right now. So the faster group is a credible institution. They are part of our data analytics team. We have worked with them from the start. They had been giving us the data or the analytic numbers from the start of this response.
Okay, so yung sa kanila, kailangan up to April 18. Yung sa IATF, gawin na linggo-linggo na lang muna natin, mag-extend na lang tayo on a linggo-linggo basis. Pero parang obvious naman, Usec, na hindi bumababa yung numbers kasi sabi nga natin noon, nung nag-ECQ, maibaba lang natin ng 20%, happy na. Hindi, tumaas pa by 20%. So, malamang at malamang. Kasi hinahanda ko na Pasensya ka na, Usec, ha. Pinaprepara ko na yung tao. Harapin na natin yung katotohanan that we will have to do a longer lockdown. Now, if we do a longer lockdown, what will be the outcome for our hospitals? Because I just found out this week that some of our hospitals here are full, not because of people from Lipa, but because of people from the NCR Plus who have been referred to the regions dahil wala na kayong paglalagyan dyan sa Manila.
Well, one of the objectives of the hard lockdown would be for us to decrease the mobility of people. Pag na-decrease po natin ang mobility ng tao, transmission will be cut, eventually. And by doing that, bababa po yung mga kaso. And therefore, pag mababa ang kaso, less ang hospitalizations. But another objective of this lockdown would be for us to manage better our healthcare system. Unang-una na yung mga ospital. Kailangan po natin talagang pag-igtingin. We need to strengthen yung ating referral system. Ang nangyayari po kasi ngayon, nag-choke ang mga ospital kasi lahat ng tao, because of their fear, because of their panic, goes to the hospital. So you would see our emergency rooms talagang jam-pack po tayo sa ER hanggang sa labas, marami po. And then while we did our assessment across the hospitals, we found that almost 50% of those admitted are mild and asymptomatic. So we need to manage that problem. So that problem will be managed. We have instructed our local governments, you should have your incident command systems within your local governments. And this incident command would be the ones to triage patients, whether they have to go to the hospital or they have to be transferred to a temporary treatment and monitoring facility. This one thing would really help our hospitals be decongested. So another thing would be, of course, we need our hospitals also to be augmented with their resources. Ngayon po, nakikita natin, nauulit na naman po yung healthcare workers natin na naapektuhan itong sakit na ito. Marami po ang pawala dun sa list ng cadre nila. So they cannot really expand their beds if they do not have the healthcare workers that they need. So now we are trying to mobilize yung mga strategies po natin para magkaroon ng karagdagang healthcare workers ang ating ospital. So the objectives of this ECQ are two: to decrease the mobility, therefore we decrease transmission, and also for us to be able to manage better our healthcare system.
Usec, has that been addressed or discussed at length sa IATF or with the DILG? Kasi lagi ko nadidinig, primary care sa mga barangay, etc. But now that you mention it, I rarely really see you're a doctor, a decent, real clinic in most barangays. Nauuna pa yung basketball court, nauuna pa yung multipurpose gym, yung marami dito, ang lalaki ng basketballan, pwedeng maglaro yung PBA, pero sabi ko, kung gawin na lang field hospital sa mga yan, we might be able to relieve those hospitals, and every barangay has so many retired doctors and experts. Why are we not sounding the call, Usec Vergeire? Pasensya ka na, I'm just trying to help.
Yes, sir. There's a open call right now. Unang-una, nagkaroon ng mobilization ng ating uniformed personnel. Their medical reservists are being called on to help
Mhm.
already. We also had a call from our other regions, those who are willing to volunteer from the regions where there are not this much cases. We are going to mobilize these cadres para papuntahin po dito sa NCR plus bubble natin. Another
Mhm.
thing would be, yun nga po, yung mga ating mga residenteng graduate na from our hospitals, yung mga
Mhm.
naka-deploy sa ibang lugar, binabawi muna po natin sila, pinababalik sa ospital para po makatulong dito sa ating mga ospital. All of these efforts are being undertaken and hopefully we can have additional manpower for our hospitals in these coming days.
What about those things that I mentioned? Yung kasi maganda yung idea yung sinasabi mo na at the barangay level dapat na-address na yung initial care. Kasi yun nga rin po sinasabi ko eh. Dapat sa bahay pa lang maresetahan na yung mga mamamayan natin. O pag may naramdaman kayo, ito para sa hindi makahinga, ito para doon sa mga mataas na lagnat o para antibiotic, which I discussed with Dr. Limpin yesterday. And she was saying, Sito, actually, ginagawa na yan eh. Ginagawa na yan. Pero it has not become a national policy ba? Because of course, we don't want self-medication. But we also don't want the problem you're mentioning na 50% pwede namang i-treat pala sa barangay o sa bahay.
Yes, sir. Actually, meron naman tayo ng mga primary care units sa iba't ibang barangay. Ito po ay pinondohan talaga ng Department of Health for a number of years already. Ang
Yeah.
kailangan lang po talaga maging proactive tayo. Like this code strategy that the local governments are now implementing, ito po yung nagbabahay-bahay po sila. And this is the Daravi model na ina-adapt natin from the other countries na gumawa po nito. Bahay-bahay, ma-identify sino ba yung may simptomas, sino po ba yung na-expose, sino pa yung close contacts, at ilalagay nila sa isang lugar para ma-monitor nila. By doing this, they can already be able to triage.
Mm.
Makita na nila sino ba yung dapat i-ospital, sino ba yung dapat na naandyan lang po sa barangay o nasa kanilang mga bahay or quarantine facility para bantayan.
Ayun. Okay, Usec, kung mamarapati nyo, I just request for a few seconds for a quick break. When we return, pag-usapan po natin itong mga testing, etc. Kasi may nagtataka bakit daw binalik itong rapid test and antigen. We'll be right back here on Agenda. You're back here on Agenda. I'm your host, Cito Beltran, and we have with us as our final guest for the week, Undersecretary Rosario Vergeire. Usec Vergeire, ito po pinapatanong ng news desk. Why did the DOH decide to officially include rapid test antigen positives, which are sometimes inaccurate compared to the gold standard RT-PCR test? Doesn't this break your previous statements that RT-PCR is the gold standard?
Yes, sir. No, no, it does not break our previous statements because in our existing guidelines, rapid antigen test can be used in outbreak situations, which we are now having in this NCR plus bubble. Kaya
Mhm.
nga po na nag-usap ang IATF at pinag-usapan ang mga measures. Isa po ito sa nairekomenda para mas mabilis po ang pag-identify natin dun sa mga taong nagpa-positive. This is based on science. This is based on evidence. We have discussed this with WHO that the rapid antigen test can be used in areas where there are increased incidents, katulad po ng nangyayari sa atin ngayon. Now, because we are going to use this for this outbreak situation, kailangan na itatala din po natin officially para na idadagdag po natin ilan po ba yung nagpositibo sa antigen because we are now going to consider them as official positive cases, no more confirmatory. So ito naman po ay base na sa existing guidelines natin from the start that we had this rapid antigen test in the country.
So pag ginawa natin yan sa isang household, if we rapid test 4 individuals and 2 out of 4 test positive, sorry, pakyawan na ang labanan dyan.
Yes, sir. Kung nag-positive sila sa rapid antigen test, parang positive ka rin sa RT-PCR. No, we consider you as a positive or a confirmed case of COVID-19. Pero kailangan po nating paalalahanan ng ating mga kababayan. Gagamitin lang po ito dito sa ating mga komunidad na matataas ang kaso. Dahil yun nga po sa ebidensya, ang rapid antigen test, accurate lang siya kapag dun sa mga taong may simptomas o di kaya ay dun sa mga taong nagkaroon ng contact sa isang taong may positibong kaso at doon sa mga sitwasyon na meron tayong outbreak katulad ng nangyayari sa atin ngayon. Kahit po tayo ay nasa NCR, halimbawa po, naggagawa kayo ng screening para makapasok sa inyong opisina, naggagawa kayo ng screening para makapagpunta sa establishments, hindi ho yan pinapayagan. Hindi po natin isasama yan dun sa positive list natin na konfirmado. Ang atin pong sinasabi, we can use this in the community to identify faster these people who are infected so that we can extract them and isolate them.
Okay. Now, yung pasensya ka na, Usec, I know that I have to compliment you for your patience because I know you keep being asked the same question time and again, but not everybody watches programs all at the same time or all the same interview. So, eto, may tanong, yung mga gamot daw na for COVID-19, etc. You are one of those who strongly discouraged people from using ivermectin. And now the ARTA is saying to the DOH or FDA to fast track the applications for ivermectin. What's your reaction to this?
Yes, sir. ARTA kasi, sila po yung agency ng gobyerno na dapat wala tayong mga red tape, dapat yung bureaucracia ay maiayos natin para rational ang ginagawa natin. We understand that. We actually we have a meeting with them after this interview. So ang punto lang po natin ganito. Ang atin pong pinapatupad, no, ang atin pong gusto natin malaman ng ating kababayan, unang-una, kailangan lahat ng iniinom nyong gamot ay rehistrado ng Food and Drug Administration. So, with that being said, yun pong ivermectin, hindi po siya rehistrado for COVID-19. Hindi pa po siya napag-aaralan. May pag-aaral silang sinasabi, pero sinasabi ng eksperto natin, kulang pa yung pag-aaral eh. Kasi yung mga pag-aaral na lumalabas ngayon, hindi pa rin niya sinasabi na it can provide you that protection that we are saying about ivermectin. So the recommendation of our experts would be, and DOH adopted this, further studies. Pag may lumabas pang bagong study na sinasabing talagang magbibigay ng good outcome, gagamitin yan. Open po tayo sa lahat ng yan. But up until that time na dumating po yung study na makakadagdag dun sa ebidensya natin, ang DOH po is on that side where we are not going to recommend this for use of our citizens for now.
Okay,
Yun
the
po
official position. Okay.
Yes.
Usec, quickly na lang, alam ko may meeting ka. Yung Linwa, ito kasi may foreigner, si Mr. Blackmon, nagtatanong, what can you say about this product? Sabi, malay ko.
Well, ito pong Linwa capsules ay registered po yan ng FDA, no? So nakakapagparehistro sila at ito naman po ay ginagamit yata ng iba natin mga kababayan. It's a supplement actually. It's not a something that take na makakagaling talaga sa COVID-19.
Okay, then regarding the vaccine, some people are puzzled. Maybe you can clarify this point. Sinabi ng FDA in the early stages of vaccine processing that the Sinovac vaccine has not been tested for senior citizens. But we are now in many localities injecting senior citizens with Sinovac. What's going on? What is there that we don't understand?
Well, unang-una po, no, lumabas ang Emergency Use Authority ng FDA. Nakasaad mismo dyan, you only use Sinovac for 18 years old to 59 years old adult population. Una po yan. Pangalawa, sumulat po sa atin ang Chinese government, yung manufacturer nila. Sinabi nila mismo, wag niyo munang gagamitin yan beyond 59 years old because studies are not complete yet. So having two evidences or documents with us, talagang nilagay po natin sa guidelines natin na ang bibigyan lang muna po natin ng Sinovac would be the 18 to 59 years old. Yun pong ating mga kababayan na senior citizens, they will receive the AstraZeneca vaccine for now.
So hindi dapat Sinovac ang papasaksak nila if they are senior citizens.
Yes, sir. Sana po mag-antay po yung local governments natin kasi yung iba po, naubos na yung kanilang supply ng AstraZeneca. Kaya siguro po ginagamit na rin nila yung Sinovac na mas marami silang stocks para sa senior citizen. Pero tandaan po natin, sinabi na po natin doon sa EUA, sa guidelines na 18 to 59 muna po para sigurado tayo we're erring on the side of caution.
Okay, well, thank you very much, Usec Vergeire. I really appreciate that guidance because alam mo naman ako, I am pro-vaccination. Lahat ng klaseng bakuna natanggap ko na. Sabi ko, tinanong ako din sa barangay, magpapasaksak ka ba sir ng Sinovac? Sabi ko, kahit ano pang bakuna, saksak nyo. Nagbabakuna nga ako ng manok eh. Okay. Thank you very much, Usec Vergeire. I wish you a peaceful Holy Week and that you get some rest. You have worked so hard along with the DOH and God bless all of you out there. Thank you very much, ma'am.
Maraming salamat po, sir.
Okay. Yan po si Usec Maria Rosario Vergeire, Undersecretary of the Department of Health. Ayun po, no? Medyo maganda yung pagliliwanag na yon. Yung pong bakuna para sa senior citizen, hindi po dapat gagamitin ang Sinovac. Ang ginagamit po ng AstraZeneca. Pag sinabi sa inyong Sinovac at kayo ay senior citizen, maghintay na lang po tayo kasi baka biglang magsalita ka ng Mandarin, ewan ko lang, no? Pinapatawa ko na lang kayo, pero follow what the authorities say. And I also watched an interview. Medyo kakaiba yung nakita ko dun sa interview from a official in China. Sinabi, yung validity ba? 6 months. Sabi ko, anak ng ewan, 55% ano na nga ang galing, effectivity, pagkatapos validity 6 months. Talo mo pa yung talo mo pa yung passport pag anyway, okay, we will have to take a break. Go because we've run out of time. I'm Cito Beltran, thanking you for joining us this week. Thank you to all our guests who've been giving us a lot of insight and useful information. Please spend this Holy Week in reflection. Rest muna tayo, ha? Rest muna, pahinga. Peace be with you.